I have been a midwife for 46 years this year. Graduated from midwifery school in 1975 and have worked as a midwife in a variety of settings, from my own private practice to FQHCs, to small community hospitals, and I was chief of midwifery at a teaching hospital here in New Jersey for 26 years. I also have a background in public health, and hopefully the last degree I'm going to get at this point is a social work degree. So I really became aware of the impact of FASDs probably about 10, 12 years ago. I had met a physician who herself has children with FASD, and her story was so powerful that it really made it personal, right? And that's when it becomes personal to you, that's when it really grabs you and you say, this is something I really need to do something about. So I began to talk to my patients about it, which I really hadn't done very much in the past, and went then and got trained in SBIRT so that I could really have those conversations with women and birthing people, not just in the birthing space, but in the women's health space also, talking about use of alcohol and how that can impact your own health, and then subsequently how it can impact the health of your unborn child. I then developed a relationship with the physician who had introduced me to how important discussing this concept was, and brought her to our hospital for grand rounds. And I was really impressed, not in a positive way, by the reaction of the staff, of the midwives and the physicians and the OBGYNs who were at grand rounds, because they really at that point just felt, well, this is something that only certain people have a problem with. This is not something we need to talk about with everyone. And the presentation that she gives, she starts talking about the statistics and everything, but then she throws up pictures on the screen, and they're of herself when she was using alcohol and how the physicians were enabling her. Everyone kind of sat up at that point, and it became real to them because this is one of their own, right? So it became a real story. And I realized how much we need champions like her to go out to practitioners and help to make it real for all of us as practitioners. Help us to understand that this type of counseling is just as important as talking to people about gestational diabetes or preeclampsia. And it needs to be part of what we all do. So then the relationship with this physician continued, and she introduced me to the New Jersey Task Force for the Prevention of FASD, which is part in New Jersey of the Governor's Council on Prevention of Developmental Disabilities. They had been looking for somebody in the OB space to be on this task force for years, actually, and kept reaching out to OB physicians with no luck. And so she's like, well, you're a midwife, you can come do this. And I'm like, okay, well, I have this whole public health background, and it really fits with that. So I joined that task force, and am currently the co-chair. What I think it's important is for us as midwives to realize that we can get beyond the examining room, right? We can go beyond that conversation with individual women. The conversation with individual women is really important, but taking our voice out into the public and utilizing that voice in other spaces on a wider level can also be really powerful and have a really powerful impact.